Hey, everybody, welcome to Hormonally Speaking. I am here today with a woman that I'm excited to have on because it's a little bit different topic than what we usually talk about hormones. And it's like a super important topic. And so I'm kind of ashamed I haven't had more guests on talking about this before. But her name is Tara Thompson, and she is a pharmacist and patient advocate in the field of sexual health. She recognized the lack of pharmacist education as the drug experts in the field of sexual medicine and knew she could make a difference. She created her website, thesexualhealthpharmacist.com, as well as her Facebook and Instagram pages with the same name, in order to bring education to the public surrounding sexual medicine and the drugs involved in a patient's pathway of care. Her passion is treating, counseling, and educating patients and providers alike about men and women's sexual health conditions ranging from vulvodynia and interstitial cystitis, which we have talked about both of those on the show, to erectile dysfunction and Peyronie's disease. Tara has been a practicing compounding pharmacist for 8 years in the field of sexual medicine, developing and designing pharmaceutical drug combinations for various sexual health conditions. She collaborates with providers nationwide who practice sexual medicine. She's working towards her sex educator certification through AASECT, which she hopes to complete by 2021. She also co-developed an advocacy panel called Just Ask, which hosts different sexual health experts on a monthly basis to encourage patients to ask any questions surrounding sexual health. So good and so needed. She is a supporter of the LGBTQ community and also an advocate of mental health and the fight against sexual trauma and trafficking. Tara is currently researching and gathering evidence for drug treatment protocols in the field of transgender medicine, which we're going to talk about today too. As a pharmacist, Tara feels like she brings another element of care to the healthcare team in terms of drug decisions, strengths, and dosing. In her spare time, she loves to cheer on the Atlanta Braves, kayak the Etowah River, and build forts with her kids. Welcome, Tara.
That was long.
I know, but it's so good. You had I know. I was like, should I skip some of the stuff? But I was like, oh, people need to know this about her. Like, it's
It's
pretty,
interesting. Yeah.
it's very interesting. And it's very, it's just so varied in this arena, right, of sexual
hmm
health. And there's so much that goes into sexual health that I think so many people don't think about and don't even, or don't want to look at. Let's put it
Right.
that way, right?
Exactly. You're exactly right. Yeah.
Yeah. And because, I know personally, and, I know other women, like it can be scary when things start to go awry down there
hmm
in any form or fashion. So let's start off with what are some of the most common sexual health issues that you see happening for women?
Sure. Yeah. So, I guess like as a pharmacist, we try to make the patient feel comfortable in what they're talking about. Like I always want to make sure that the customer, the patient, they feel, like they can tell me exactly what's going on instead of, kind of sugarcoating it. I really want to know exactly what's happening. How are you feeling? What have you done to try to help this either non-pharmacologically at
Mm-hmm.
home or over the counter or with prescription drugs? And um, I think the best thing we can do as both like educators and healthcare providers is just say, what you're dealing with is not uncommon. So, I mean, this is something that's real. You need to talk about it.
Mm-hmm.
It's definitely a real condition that's out there and it can be treated and there are options, but unless you talk about it, then you'll never know. So,
Mm-hmm.
um, I think some of the most common things I see, especially in the older, I'd say probably after 40s, like your perimenopausal, postmenopausal patients.
Mm-hmm.
For them, it's more of like hormonal issues,
Mm-hmm.
hormonal imbalance, which those lead to your decreasing estrogen during and after menopause, and you're decreasing testosterone over your lifespan.
Mm-hmm.
Those particular conditions or those particular hormones have so much to do with sexual health in terms of vaginal dryness, vaginal pain, issues, as your vaginal mucosa gets thinner and thinner over time due to a lack of estrogen, that can expose nerve endings,
Mm-hmm.
decrease your lubrication pools, and just very painful. It's
Mm-hmm.
actually
Ow.
really funny. I went to a conference about sexual medicine and they took a poll of women who were in menopause or postmenopausal women, and they had them pick out, they showed all these pictures on the screen and they were like of a cactus, of a desert, of a, you know, beach oasis, and all these different ones. And they said, describe how it feels down there for you. And these patients were vaginal atrophy type vaginal pain patients. And the most popular pictures that were chosen were the cactus and the desert sand, rolling sand hills, and the just pain, pain, pain. It was all about pain. So I think that's probably the most popular one that I hear. Today, actually, alone, I heard of in younger patients who maybe are just now getting sexually active or just got married and are doing that whole thing. And even, you know, patients with partners who they're exploring types of sexual activities with, they have that pain upon penetration or that deep vaginal pain upon insertion. And so I actually had a patient this morning, we were talking about how the pelvic floor muscles can play so much into your sexual pain that you're having. You're clenching up, you're having what's called vaginismus. It's like, you know, just the tightening of the levator antemuscles. And there's drugs that can help that, you know, and there's non-pharmacological ways to do that as well. There's, you know, sexual health is also about mental health. There's a mental health component that you have to be in the right state of mind. There are, you know, with your partner or yourself or your past trauma that you're thinking about. So just so many components. It's not, you know, so easy, but I see conditions across the board from adolescent to the elderly population, most definitely, in men as well. So
that's
they
amazing.
deal with separate issues.
So many different issues, I can only imagine.
So many
but
issues.
I mean, I'm glad that you brought up the aspect of, you know, the mental health component. And I talk a lot about the stress component, right? Because women are under so much stress now as compared to even, you know, 20 years ago on a different level, and are trying to do all the things. And then of course with COVID happening, there's, you know, another level of that happening where you're having to whatever, teach your kids, suddenly homeschool them while working, and this and all that kind of stuff. And particularly when you're in menopause, or excuse me, perimenopause, going into perimenopause, it's like that the shift of the hormones naturally compounded with, you know, the stress that's going on. And like, you have to think about the years of stress too. And then your, you know, poor adrenals are just overworked in a lot of women. And so, you know, this all shows up in sexual, I don't like to call it, and I don't know how you say it, sexual dysfunction, but like in sexual issues, right? That
Correct.
show up for women. Yeah.
I try to stay away from dysfunction, but it comes out sometimes. It's still used like in the medical field, but
that's what,
I try to say sexual health or sexual conditions, but it's like female sexual dysfunction is a real like term.
It's a legit thing out there.
It's a legit thing.
And I was like, that's what, and it is funny because in a lot of, you know, a long time with allopathic medicine, I feel like there's that idea of sort of placing things in that dysfunction realm, and it wasn't even done on purpose in a negative way. It's just you know, the impact that it can have on people, for sure. And so, you know, with say a woman coming to you with just like, okay, you know, the major issues that I'm dealing with are that I don't have enough lubrication going on, or that I have pain. Like, what are some of the approaches that you take in that situation?
So I always want to make sure like that, you know, they're seeing a provider obviously for their particular condition. Because as a pharmacist, you know, we can't diagnose. We're just giving, you know, on the front side, we're kind of able to recommend over-the-counter type products and supplements that could potentially help them. So adrenal support supplements, thyroid support supplements, lubricants, Kegel weights, dilators, that type of thing, vibrators and things that could help them, you know, in those particular instances with muscle mass and just making things less painful. But then on the backside, when it comes to prescription type therapies, I'm always making sure that they have a provider that they're seeing. And if they're not, then giving them the resources to go find one. And there are providers that specifically, I mean, MDs, DOs, nurse practitioners, PAs, pelvic floor therapists out there who specialize in this type of medicine. And a lot of patients, for many, they don't, that's all the education they need, because they didn't even know that existed in the first place.
Right.
So they're just
Such a good
thinking,
point.
oh, can my OBGYN do this? And I'm like,
Right.
some of them can. Yeah, they definitely can, but they might not be specially trained, or not have like the clientele that warrants them to get this extra education for sexual medicine. But certainly some do. And but yeah, I just making sure they have the resources. I refer them to, first of all, asking where they're from, if they're Georgia, Texas, California, wherever. Trying to just get them hooked up with a provider that, that we may know in the area, or that are on some of these national databases that they can go look up for pelvic health or vulvodynia, whatever their condition might be. Getting them in the right place. And then as a pharmacist, just especially with the OTC options, yes, but also just an education and advocacy piece, like, hey, it's okay to ask your doctor about this. Don't be scared. There's counselor or sexual health counselors and educators and people out there who they want to help you, and there's ways that they can help you. So I think for patients, when you open that floodgate, they just start talking, and I think that's the best piece of it all.
That's the best medicine.
Like, thank you so much.
Yeah, absolutely. Well, it's funny because I'm such a huge advocate for pelvic floor physical therapy, because I had a surgery that went wrong, and I ended up having it was a fibroid surgery. I had a fibroid removed, and they unknowingly burned me in 3 places in my intestines during that. And I ended up having multiple emergency surgeries and had an ostomy. Long story short, my abdomen was like, gone.
Wow.
Like it was broken. And you don't realize how important your abdomen is until you can't use it, and you're at such a threat for getting hernias after you've had multiple abdominal surgeries. And so, I had to wait probably about 4 months or so, but I definitely slid into working with a pelvic floor PT primarily to help me rebuild my core. And I credit her with doing that, like safely, because that's the thing, is that like, it's such a balance with that. You have to, you don't want to push it too hard because you don't want to create a hernia, but like it's strengthening that core is going to help protect you from a hernia, and so that's what I went to her for. But then we ended up doing, all this like vaginal stuff too. And I was like, oh my God, I had no idea that I was like so tight, like that I had such tight muscles. And a lot of times like low back pain, it can actually be from, it's just too tight in there. And
it's all connected. You don't realize it.
It's so all connected in there. And, particularly like, I think there's this, the Kegels or the Kegels or however you say it, has been, a thing that's become part of our culture and pop culture. And women are like, oh, I'll just do that when I start having whatever. And it's like, that's not actually always good. Like in my case, I need to do the opposite, and so that's why it's important to work with somebody that knows and understands these things. And then that ability to really talk about all these different elements is just, I think it changes lives. So I'm always like,
definitely
for PT,
Yes. And pelvic, I love pelvic floor PTs because they're just trained in a way to, the atmosphere is more private. They know exactly, like they have the correct tools that you need. They know the areas and the muscles so much, more intimately that way. And I've learned so much from pelvic floor PTs. There's some outstanding ones out there for sure. Yes.
Well, and I also just appreciate the work that you're doing because, to me, it sounds a lot like you're guiding people to help build a team for them. Right. And that's what we need around this. And I think women in particular, like it can be as simple as like, I'm going to one practitioner and they're just not hearing me or helping me in the way that I need, but like maybe that's not their strength, that thing that you need help with, right? And so if you're working with, whatever, an OBGYN, and then you have a pharmacist like you that can guide, on other places to go and things to do, and then pelvic floor PT, it's like you're just really coming at it from all directions and things are going to look a lot better. The outcome is going to be a lot better.
Right. I think collaborative practice is in terms of there's different components that each person can bring to the table. The most important being the patient, just because they're they're the first line. They know what's going on with their body, and a patient is more in tuned with their body than any one of the people on the healthcare team. So it's important just to listen to what they have to say and not to discount any little symptom they might be having, because it could be related to their thyroid, or it could be, there could be a mental thing or something in the past that it's like, you never know. And I try to provide education for clinicians and providers and OBGYNs and urologists and people who they're specialized in certain areas of medicine, but like this is always an issue. Like they always have a patient who comes in and like has vestibulodynia and they're like, I don't know what to do. And so, right. So that's where I kind of come in. I'm like, okay, well, let's talk about the different like sexual health conditions. Even if it's, hypertonic pelvic floor, just anything. It could be lichens conditions of, the labia. I mean, anything like that. Sometimes they're just not as educated in the sexual health piece. And now, especially like kind of about what you were saying earlier about the LGBT community, the transgender community, and just like being accepting and having your clinic be, I guess, friendly in terms of using the correct pronouns and like not conforming to having your patient handouts and pamphlets not be so, male,
gender
female.
specific.
So,
yeah,
exactly. So
there's
so much education to be taught, and then also from a patient perspective to learn and to know that like even patient health platforms like this podcast or some of the place that me and you met, like there's places where patients can go that they can share their stories and get, feedback from other people as well. So there's just resources out there.
Yeah. And sometimes it's like, it's just getting to that right person. And so that's why your work is so important. And I'm so glad to have you on to talk about this. So we want to hear a little bit about your story and how you really got into this work, because it's, like, how did you decide that this is the route you wanted to go?
Yeah, it's funny because you never think that you're going to be somewhere and then you're there and you're like, okay, well, I guess this is what I'm going to do with my life. Because I certainly didn't in pharmacy school when I was sitting there, listening to a lecture on cardiology, did I think that I was going to be over here in sexual medicine. But they don't teach a lot of, they don't teach any sexual medicine really in pharmacy school. They teach reproductive medicine a little bit, of course, obstetrics, gynecology type medicine. But they don't teach a lot about the hormones, which I thought, I didn't know until now, but is very interesting, and not a whole lot about sexual medicine at all, only in terms of birth controls and contraceptive type issues. And so when I graduated, I started working for the place I work for now, Compounding Pharmacy, and we one of our biggest patient populations is women and menopausal women, because we do a lot of hormone replacement therapy, topical, oral, vaginal, injectable, pellet, all that kind of stuff. So
all of them.
And I didn't know much about it, so I really researched a lot and went to conferences and just educational seminars, webinars to try to learn more about this. Well, once you start to get into hormone medicine, it leads you into sexual medicine, because it's basically a cause and effect relationship for that. So I was like, okay, well, and then come to find out there's so many organizations that deal in sexual medicine, and there's nurse practitioners who specialize in women's health, that's all they do. And you have your sexual health counselors and your sexual health educators and people who are certified for marriage counseling and couples counseling and mental health and stuff like that. And I just saw this world that was so much, it was kind of hidden, but then once I started looking for it, it was like so big. It was like the underworld or something. It was like underground. But now it's like, And so over the years, I've just slowly started, educating and getting to know. And I've realized that, I have pharmacy students that rotate through our site, and I go talk to colleges of pharmacy too. And these, urology groups and urogyne groups. And
Mm-hmm.
a lot of the time, like, they don't know much about it. And so I
Yeah.
think that that's where I came in as a pharmacist. I'm like, look, there's pharmacological therapies that could be helping these patients that not so many people know about. They're just putting them on some sort of like oral drug and like, oh,
Right.
here, go figure it out. And
Right.
when the root cause or the underlying issue is maybe a hormone imbalance,
Yeah.
or maybe it's just maybe there's an issue with the musculature in the pelvic floor, and they need some sort of like little muscle relaxant or therapy or pelvic floor therapy or
Mm-hmm.
something.
Mm-hmm.
So I think that that's just where I came today, is just like from learning about it myself, just being interested in it, and then seeing how many patients come forth with this type of like all types of issues, men too, erectile dysfunction,
Mm-hmm.
Peyronie's, and premature ejaculation. Like those are all
Mm-hmm.
sexual dysfunctions in
Right.
men
Right.
that they want fixed,
Of course.
So,
Yeah. Yeah.
anyways, just kind of
Definitely.
went down that road, and here I am today, like trying to, educate more people, and
Yeah.
still, practicing pharmacist. I still go verify prescriptions on days that, I'm not
Yeah.
researching, but yeah, so it's just very interesting. And I'm so glad that, there's people like you, and there's some clinician blogs and patient blogs out there and YouTube and that kind of thing, and so many great social media, Instagram and Facebook, just influencers and advocates and patients and doctors who are just like putting it out there. And I love how today's world is just getting more inclusive of
Yeah.
LGBT and women and, people of color and transgender. And it's just like, it's awesome.
Yeah.
I'm psyched.
Because
I think there's so much.
all of those people have suffered for a long time, right? And with a lot
Right.
of this stuff that it has, remained hidden,
Yeah.
and hidden from themselves, hidden from their doctor, or their doctors didn't know what to do about it. And I think
Mhm.
a lot about women, and you probably know this, from your training. It's this science and studies weren't really done on women until very
Yes.
recently for a lot of this stuff,
I
right?
just read that New York Times, there's a New York Times article out. Oh
Yeah.
my gosh.
It's amazing, right? Like
Bizarre.
things that were specifically for women weren't even tested on women, And
Like
so,
vaccines too.
yeah, absolutely. And
So,
our bodies, as we know, I mean, we tend to be, much less in weight, but B, like the hormonal impacts of these things, how that
hmm
impacts our hormones. And that's pretty much why they didn't want to test women, was because of the hormonal fluctuations.
right.
And so here we are, and I do agree with you. I think we're at this like amazing time where it's just this like explosion of information coming out, and I know it can be overwhelming sometimes for people too, because it's like, okay, well, this person says this and this person says that, and so it's
hmm
definitely not as simple as just like following some blogs and things like that and
Right,
trying to
right,
figure
right. Of
stuff out
course.
on your own. But that's why, I know a couple of pharmacists, and this was part of why I wanted to have you on, that I really see as that kind of bridge that's happening between traditional allopathic medicine and functional or
hmm
alternative, and those aren't exactly the same things, but people tend to lump those
hmm
together,
Sure.
because ultimately I think they have to be bridged. When they are bridged correctly and right, that's where you get the best, the best,
Exactly.
right?
Exactly. Yeah.
And there's still a lot of not just separation, but like I feel like anger on both sides, maybe, of not,
Huh.
wanting to like come together. Particularly, I think some people that are steeped in traditional ideas, they're like, well,
hmm
this is not proven, da da da, and all these kinds of things.
hmm
So, I'm curious from your perspective, do you see yourself kind of as a bridge? And what are some of the issues, do you think, that are really pertinent to like, you know, keeping this bridge from really being built
hmm
fast and well, yeah, and moving into the future?
Yeah, I get what you're saying. I think that like it just depends because you have your, I don't know, you have your traditional docs and your traditional providers and traditional people who they're very by the book and they're reading, um, FDA approved products, and they're reading like guidelines and everything, which are fantastic. Like that's why we have that medicine. Medicine is fantastic. I mean, it heals, but a lot of the times what I've seen, I always use the example of insomnia. So say a woman has, or a man has insomnia. Well, traditionally in Western medicine, we're like, okay, well, we have we have Ambien, and we have, Zoloft. We have these drugs that you can take at night and it'll help you fall asleep. And so patients like, oh, great, sounds good. I want that. I need to sleep.
Yeah.
Well, little do they know, or a little education would have just shown, not in all patients, but in some, that there was maybe just a hormonal imbalance there. Maybe they were low in progesterone and they needed some oral progesterone that could have, brought the progesterone levels up,
huge
take
difference.
the estrogen down, and fixing that imbalance. Or maybe it was a thyroid issue to where they were hyperthyroid and they couldn't go to sleep, or they were taking some supplement or drug or something at night when they should have been taking it in the morning, causing them to not sleep. So I think instead of, where I like to be the bridge per se, is in education, where it's like, hold on a second, before we just go put some Ambien on there, let's take a step back, let's get some labs, let's figure out what's going on, root cause for the patient. Why are they not sleeping? What's going on in their body or brain, or what is it, anxiety or what, and fix that problem. Because sometimes when you fix that root cause, that's where your holistic traditional, that type of medicine comes in, is very root cause and what's going on in the body that we can fix with something besides a Band-Aid.
Right.
And so I think that's where I try to be the bridge in education, because sometimes that's all that's needed to correct an underlying problem. Because we all know, like, just insomnia as the example here, there's so many, but if you do start a patient on something like that, there could be a chance that they get addicted to it. They can't get off it. They rely on it for sleep, and now they can't sleep normally without it. And just the cascade of events that may follow or could follow, putting somebody on a drug when really there was an alternate way to fix that issue.
Right.
And that could be with vaginal atrophy too, or pain or something like that. Oral pain pills, give them oral pain pills, but we know that there's other ways to at least try first.
Right. Exactly.
Try first.
Yeah. There's so many multiple ways. Right. And, as you were talking, I was thinking about, just the like, often women will go with an issue and a doctor will just say, "Oh, we'll just put you on birth control." Right. That's a big,
that's a good example.
that's the jump too, right? Like, right. But even, I see it with, my clients that are in their 40s, some of which have never been on birth control or haven't for years. And the issues that they're having now, they're saying, "Oh, let's put you on birth control." And, a frustration for me will be that there are doctors that don't understand that progestins and progesterone are two different things, right?
Oh, yeah.
And I imagine you as a pharmacist, because I know this is true with the other pharmacists I know, like, to educate on that is a huge thing, because there's so many, they weren't taught that there was a difference in med school. Right. And so to them, it's the exact same thing. And it's like, they're completely different things. One is bioidentical to what we, make in our own bodies. And the other one is chemically, different and will have different effects. And, also they don't necessarily jump to like doing hormone testing. I've had clients that their doctors are like, "Well, your hormones fluctuate all the time, so that's not going to do us any good." It's like, okay, well, so if you understand what things are supposed to, generally look like at any given time during a cycle, and you understand the cycle, then you will know what you're looking for in that time. And so my hope is that there'll be more doctors. And I think there are more doctors already, but that more and more will say, "You know what? This is not my area. Even if I'm an OBGYN, this is not my area of expertise of fully understanding, working with bioidentical hormones. So I'm going to send you to someone that does understand these things, instead of just being like, nope, that's, we don't need to do that. Let's just get on birth control." Like, no. Please
And
don't.
as a patient too, just knowing that there are other options for you out there, I think is huge too, because so many, patients just think, whatever my doctor puts me on, that must
Mm-hmm.
be the right thing. But
Mm-hmm.
you never know when there could be another option out there. So just educating yourselves on or asking for help from, expert or people like that have been in this field for a while, and these, podcasts, and listening to them, and just knowing that there might be other options out there that you can naturally or with bioidentical options, or
Figuring out some other
instead
stuff.
of
I mean,
putting
yeah, the
Band-Aid on it.
cortisol thing is such a huge, underlying issue, the adrenals. And so I like to look at that even first, especially for
Hmm.
women in this age group that are under so much stress. It's like we got to
Yeah.
get that stuff in order. And a lot of
Right.
times things will take care of themselves. But yeah,
Right.
I was also just thinking about, like, I mean, with endometriosis being such a kind of, I feel like it seems much more prevalent now. It's probably just getting diagnosed more often, but
Hmm.
endo and adenomyosis and all these issues going on, that's a prime example of doctors wanting to put their patients on birth control right off the bat,
Right.
and we're
Right.
like, you know
Uh,
this, yeah, and this probably isn't even ultimately, even though it has the impact on the reproductive system, it might actually be an autoimmune disorder. Like, there's so much depth
right.
that we need to get into around this stuff, and
Right.
some women will have to get on birth control in order to handle the symptoms around that,
Hmm.
but like, there's so much stuff that you can do, and work on inflammation and everything first.
Sure.
So point of all of that I just went on and on about was that I appreciate the work that you're doing even
Oh, thanks.
more because of that stuff, because I don't want women to have to go through longer bouts of some of this stuff, and not really be able to get to the root cause of their
Hmm.
issues because of that, just getting on this one thing. Um, so let's see. Let's talk a little bit about the transgender field in hormone medicine.
Hmm.
I'm so curious I believe you're working on some protocols, right? Around that right now, like some future protocols.
Yeah, so really it's just educational pieces and protocols in order for clinics and providers to be able to correctly treat or
Mm,
correctly make that change for those particular patients. So,
mm,
um, and a lot of it's just getting your office, gender neutral,
mm,
and
mhm,
being able to have those particular conversations to where you're able to understand what's going on and the different types of sexualities that are out there, and just educating on all of that. But then from a drug standpoint,
mhm,
um, practicing safe sex, and then being aware of PrEP and HIV, and those other types of sexual health issues that we haven't even talked about today, but that's a whole nother topic.
right.
But
So
from
much.
a hormonal
Yeah.
from a hormonal standpoint, I guess it all started for me when, you know, we think of I used to think of patients in terms of male and female. So if I
Mhm,
had a female who was on high dose testosterone
mhm,
weekly, it would make me stop and say, no, this isn't right. And then if I had a male who was on some daily estrogen therapy or progesterone
mhm,
therapy or whatnot, I would stop and say, wait, this must be incorrect. This isn't the right
mhm,
dose. But in reality, and digging deeper into the patient, it was a transgender patient. And so I'm like,
mm.
okay, we need to have that
Out
mindset
there.
to
Yeah,
where
yeah.
stop looking at male female and look at the therapy, making sure that's appropriate for that particular patient. So,
Mhm,
and I've educated our pharmacist team on those types of things as well, because it is, as a pharmacist, and you're checking a prescription, you're saying this isn't right, this is too high, this patient's only 21 years old, why are they on daily estrogen, this is a male. So just kind of trying to write some protocols in terms of like hormone therapy and what that would look like, possible dosing. There's already information out there on dosing and what you would use and that kind of thing, um, male to female or female to male.
gotcha.
But just more in terms of like educating the providers, your office staff, your clinical
Mhm,
team on um, having those types of patients and being able to, appropriately talk to them and
which is
making sure that
so
they feel
important.
comfortable.
Yeah, I mean, God, that's like, I mean, it's important for everybody, but like in the situation of having to, take these hormones and go through this process, it's like, yeah, it's time for everybody to like be
Sure.
on board in this place, right?
Yeah.
Where they can speak to it in a manner that creates a safe space ultimately
Right.
for
Right.
people. So I am curious, like, are there, like, I guess it has to be specific training for doctors on the dosing with transgender patients, or is there like, because I don't know, like, I mean, are there, most doctors at this point, can they treat, can they work with that, or they have to be like specially trained in that arena to know the correct dosing? Or is it, I mean, I know everybody's individual, so they're going to have to kind of
Yeah.
play around with dosing, I would imagine, but
Yeah, I think there is specific training out there, and there's some really good organizations and associations that we can probably, post, or I can tell you
nice.
guys later, but
Yeah, cool.
um, that you can get specific training on transgender health and the population health in terms of dosing and what to do. There are now, especially more than ever, more clinical trials coming out and
Hmm.
studies, and that information is available for providers to research. I don't think you have to be specially trained
Mm.
in terms of having a certificate to see those types of patients at
Right.
all.
Gotcha.
It just is helpful to know the
To know
dosing,
it. Yeah.
because there is a lot other, things that go into it. You're going to have to, there's side effects and things that their bodies are going to change in certain ways. And then there's, you know, for, women on high dose testosterone, you don't think about the voice changes and the acne and things like that,
Hmm.
you have to be able to counsel and deal on those
Yeah.
types
Help
of issues
navigate through
too.
that.
So
Yeah. Yeah.
there
And
are people who specialize in transgender medicine that, that's all they do all
right.
day. So they certainly probably have extra training
Training.
and that.
Yeah. I was curious because, as a woman going to a practitioner for even just hormone therapy for myself, bioidentical, like I want them to be trained in that,
Yeah, exactly.
and not just be like, oh yeah, well, whatever, you
Sure.
just try this thing. And so, was, I was assuming there's definitely some experts out there, but
Right.
as it becomes more, you know, just of a thing that's happening, say, around the world, but in this country, having access to
Hmm.
those experts is probably not always going to happen, right? Because there's not enough
Right.
experts to go around. So I was just wondering if there was training happening for, just kind of regular doctors that can help people with their
Yeah, I'm
transition.
sure.
Yeah.
There's so many resources out there
Yeah.
for them, I think. And our profession, like the medical profession, tends to we tend to evolve based on demand too of the
Right.
population.
That makes
So
sense.
if you have women who are coming more forthcoming with their sexual health issues, you have more transgender people coming out and saying, I need help. And
Hmm.
then your medical profession starts to evolve and to tailor into learning more about that so that they can properly treat these patients.
Right.
So
Right.
it's kind
Absolutely.
of a you
It's the
go with the
demand
time.
kind of, yeah,
Yeah.
yeah, I see that. Well, and I like that you brought up the point before about and I've heard this about pharmacists, is like, not that you're the checks and balances exactly for doctors, but like that you will catch things if they're, super
Hmm.
busy, and or whatever, some kind of wrong information on a prescription gets sent
Yeah.
over, and you're looking at it and you're like, this isn't right, because I've
Right.
heard of pharmacists saving people's lives by
Yeah.
doing that, right? Because they're like, this
Yeah.
dosing would kill this person, or whatever kind of medication it is. So,
Absolutely. So I mean, pharmacists are the pharmacology drug experts. So that
hmm.
and there's different specialties of pharmacists, like women's health, men's health, that kind of thing. There's your
Hmm.
general pharmacist who you can go get prescriptions filled. And yeah, dosing is huge, strength is huge. And not just in the checking of prescriptions, but also in terms of being that interface between with the patient, making sure that they're staying compliant with their medication regimen. They're, is something hindering you not taking this pill every day? Like, what's going on? But also we're always answering. I mean, I have doctors call me and say, "Hey, can you help me dose vaginal gabapentin?" And I'm like,
Mm.
"Sure." And so
Wow,
sometimes they just
vaginal
need that
gabapentin.
education piece. Yeah.
So like to diminish the impact of nerves in the vagina or whatever. Oh,
Nerve
interesting.
pain, yeah,
Nerve pain. Yeah, yeah,
neuropathy
yeah,
type
yeah.
thing.
And the only reason I even know anything about gabapentin is because I had to take it before my reversal surgery, my ostomy reversal surgery.
Oh
And
yeah.
I mean, of course, I was like, oh my God, side effects, but they had me on it for like 3 days beforehand. And then, and it was super helpful in terms
Yeah.
of surgery and me not having to take pain meds really afterwards,
Right.
So I was definitely a big fan of that. So that's interesting that you can
Hmm.
use it vaginally too. I mean,
Yes, definitely.
stuff goes everywhere. Do you find like vaginal suppositories of different things are very helpful for us, like
Yeah.
going back to what we were talking about in the beginning about atrophy and lubrication issues and that kind of thing?
Yeah, absolutely. So, for vaginal issues, especially issues at the mucosa or in the pelvic floor,
Hmm.
we found, and it's pretty effective in terms of getting the drug directly to the site has seemed to be a lot more beneficial than taking something orally, letting
Hmm.
it go
Go
throughout
through
your
the liver and yeah.
bloodstream, and then liver, kidney,
Hmm.
whatever, and then finally getting down to the
Where it
small
needs to go.
area that it needed to get to
You're
after
like,
all of
come
that.
on.
And then you might have side effects, whatever. So um, we found that putting the drug directly at the site, and there's studies out there too. I mean, it's not just like
Hmm.
I did this and it worked,
Right.
but um, gabapentin, diazepam vaginal is huge for hypertonic pelvic floor.
Mm.
Creams, suppositories are big. Estradiol,
Hmm.
vaginal suppositories, progesterone,
Hmm.
vaginal suppositories for both HRT and fertility. A
Hmm.
lot of
Oh yeah, I didn't
things
even think
surrounding
about
that
for
too.
fertility. And then
Hmm.
I guess some of the stuff probably for vulvodynia is
Oh
also
yeah,
helpful too.
right. So that would be like more of a topical cream prep
Okay. Gotcha.
versus intravaginal. I guess it could
Oh,
go intravaginal too, but yeah, all types of drugs can
yeah.
be placed. A lot of drugs can be placed vaginally and have a either a profound effect on that particular disease state or a different effect than what as if you were to take it by mouth.
Yeah.
So
So I do have to
there's just
ask
different mechanisms.
I do have to ask the question because I know a lot of women do this as they get into perimenopause, but even before, is start to use progesterone, right? Bioidentical
Hmm.
progesterone, because that's kind of easier to get. I mean, it's kind of a thing right now, and I don't actually recommend doing it without knowing where your hormone levels are. But,
Right.
I do recognize that people do. Um, is it ultimately better to use it vaginally or on the labia than it is on other parts of the body, or because there's this issue, right, of it getting caught in the fat and not getting to where it needs
Yes.
to go versus
Right.
if
It
you
is
yeah.
very it's a lipophilic drug, so it does like the fat. It really depends because
Okay.
oral progesterone has a huge place in medicine.
Yeah,
The way
helps that
that it
sleep.
breaks down for sleep, exactly.
Hmm.
It breaks down a different way when it gets metabolized. So oral progesterone is great for women who may be experiencing those types of vasomotor symptoms due to hormone imbalance.
Hmm.
But progesterone on the skin, progesterone vaginally, it's still very effective in terms of what you're looking for. You can still drive progesterone through the skin and into the bloodstream when you're putting on a topical preparation. So, I
Okay.
mean, there is certainly a place for that. And it really depends on, we always say it depends on the patient. I like hate when I say that because I'm like, it always depends on the
I
patient,
know.
but it does
It's
because
yeah.
some patients might not be able or like taking a pill every day is
Doesn't
difficult
work
for
for
them
them. Yeah.
or
Hmm.
so just having those other options I found really helps with compliance and just asking them like what do you prefer or there's injectable progesterone too, like maybe you can't take something every day or you're going on a trip, I
Right.
don't know, there's
Right.
pellets and I don't know, there's so many
So many
great
options.
routes of administration. And for progesterone, all, most all of them are great. I mean, there are
Mm.
drugs that like testosterone you can't take by mouth
Right.
because it's not, it
That's pretty
doesn't,
much pellets that you have to do, right?
there's
Testosterone.
topical and vaginal
Oh, okay.
and
It's
injectable
oh,
things.
okay. but it's all prescription versus like you can get bioidentical progesterone and even estrogen without a prescription, which, I don't know how I feel about that 100%. Like, I think especially with estrogen, you shouldn't mess with that unless you're working with somebody. But I know for testosterone, that's just not over the counter at all.
It's not, and it's actually a controlled substance, so you would have to have a prescription for that.
I think I only know women that have used the pellet form, so that's why I assumed. I was like, oh, that's how it's done, so it's so fascinating. There's so much more I could ask you. I mean, I'm just like, oh man. And we only covered like that little sort of area of perimenopause, and I know that there's women obviously that listen to this that don't have that going on, but let's talk about how people can contact you and follow you on social media if you're on there.
Yeah, so I have a website, thesexualhealthpharmacist.com, and my email's on there. It's just tara@thesexualhealthpharmacist.com.
Nice.
And I'm on Instagram and Facebook. You can, on Facebook, it's The Intimate Pharmacist. They wouldn't let me say the word sexual.
Of course they wouldn't.
But whatever, it's my job. And then on Instagram, it's The Sexual Health Pharmacist. And you can always message me. I post stuff I try to post mainly about, drugs and sexual health and medicine and sexual health. And, I try to keep it like pharmacist related, but every now and then I just love like the, women empowering women posts and the Viva La Vulva posts. So I have to too, but,
gotta add that.
I'm happy to answer questions, help. I mean, there's just so many cool, like drug induced, even drugs that can cause some of these things, like you have to be aware of that when you're taking. So there's a post on that. So
that's so important. I'm glad that you brought that up because, people are on so many different medications now, and not only it's like the side effect of one of them or another of them, but like in combination too, right? That can come out, and people don't necessarily go to that place when they're experiencing something new, especially around the sexual health component. So so cool the work that you're doing. And and I'm just glad to offer people a resource to connect to other people like you out there, and also doctors that are on board with kind of this all getting this knowledge and working with this knowledge and really helping people to get to feeling better and enjoying their, not just their sexual lives, but just, I mean, it's, everything we talked about is not just about sexuality, but it's about feeling good in your body too, right? And feeling good in your life. It's such a huge, important part of life to not have pain down there.
And, sexual health covers fertility and UTIs and bacterial vaginosis and yeast. I mean, there's so many other, issues that go hand in hand with sexual medicine. So it's just know for patients that you are not alone. Your voice can be heard. Like, just say it, just ask the questions. If your doctor doesn't know about it, you might be surprised. They're like, oh yeah, I can fix that or whatever. Or at least hopefully they'll have somebody that they know that can help. And then, of course, the resources that are online, and I have some on my website too that you can check out. And
if you need to fire your dog,
there's help.
That's another one. It happens sometimes. All right. Well, thank you so much for being with us here today. It's been awesome. All right, you guys, I'll see you next time.